Today we are going to talk about plasma protein binding of a drug. So what is mean by plasma protein binding of a drug? On reaching systemic circulation, most of the drug binds to the plasma protein. On reaching systemic circulation, that means when drug reaches to the blood, that drug binds to the plasma protein. Most of the drugs bind to the plasma protein. Now there are two types of drugs, acidic drugs and basic drugs. So acidic drugs particularly binds to the albumin. A goes with A. That means acidic drugs bind with albumin and basic drugs bounds to the alpha 1 acid glycoprotein. Acidic drugs bind to the albumin and basic drugs bind to the alpha 1 acid glycoprotein. Now, there are two forms of drug, free form and bound form. So, free form, or we can say unbound fraction of a drug. Free or unbound fraction of a drug is the only form available for action, metabolism, and excretion. Right? What we are discussing now? We are discussing about free form of a drug or unbound form of a drug. That unbound form is the only form of a drug available for action, metabolism, and excretion. That means what? Protein bound form of a drug. It will serve as a temporary reservoir of a drug. That means bound form is not available for action, it is not available for metabolism, and it is not available for excretion. So only free form is available for action, metabolism, and excretion. So protein bound form of a drug is act as a temporary reservoir of a drug. It act as a temporary reservoir of a drug. Now drugs highly bound to the plasma protein, particularly albumin and particularly to the alpha 1 acid glycoprotein. We already seen that acidic drugs bounds to the albumin and basic drugs bounds to the alpha 1 acid glycoprotein. Now which are the acidic drugs which bounds to the albumin? Barbiturates, benzodiazepines, NSAIDs, sodium valproate, phenytoin, penicillin, sulfonamide, tetracycline, tolbutamide. All these are the acidic drugs, so they will bind to the albumin. Now, these beta blockers, bupivacaine, lidocaine or lignocaine, disopyramide, imipramine, methadone, prazosin, quinidine, verapamil, all these are the basic drug, so they will get binds to the alpha 1 acid glycoprotein, right? Now, there is a displacement interaction of plasma protein binding. Now, we will see the extent of protein binding varies with each drug. Means plasma protein binding is given as a percentage form. That means warfarin is 99% bounds to the plasma protein. Morphine is 35%. Plasma protein binding of morphine is 35%. Warfarin 99%. Lithium and ethosuximide is 0%. They are means they do not bind to the plasma protein. 100% available as a free form. There is no bound form of a drug like ethosuximide and lithium. So there is one thing you should know, that one drug may bind to the many sites on the albumin molecule. If this is the albumin molecule and these are the sites, if this is the site, so one drug may bind to the many sites, right? And one more thing, more than one drug can bind to the same site. One drug or more than one drug can bind to the same site. If this is the drug A and this drug A is having more than two sites, plasma protein binding sites more than two sites, and this is the drug B, and this drug having more than. Now what we are discussing? We are discussing about the displacement interaction of plasma protein binding. So one drug can bind to the many sites on the albumin molecule. It will bind to the many sites on the albumin molecule, more than one site. Conversely, more than one drug can bind to the same binding site, can bind to the same site on the plasma proteins. So that will rise the terminology that is called as the displacement interaction among drugs bound to the same site. Means there will be competition for the binding site. There is a competition for the binding site. Means they are competing for the same binding site. So who will win? The drugs bound with higher affinity will displace that bound with lower affinity. Who will win the race? The drug bound with the higher affinity will win the race, and it will displace the drug which is having lower affinity. That is called as the displacement interaction of plasma protein binding. Now we'll see the clinical significance of a drug. Clinical significance of plasma protein binding. As you can see, when the drug enters into circulation, when it enters into circulation after absorption, right, when the drug enter into circulation after absorption, it will bind to the plasma protein. Acidic drugs binds to the albumin and basic drugs binds to the alpha 1 acid glycoprotein. Now there are two forms of drug that we know, free form and bound form, right? This free form and bound form, this free form of drug is pharmacologically active and bound form is pharmacologically inactive, and it will act as a temporary storage of a drug. Free form is a pharmacologically active and bound form is pharmacologically inactive. Why? Because free form is available for action, metabolism and excretion. Bound form is not available for action, metabolism and excretion. So it is a pharmacologically inactive. So it will act as a temporary storage of a drug. It will act as a temporary storage of a drug, right? Plasma protein binding favors drug absorption. It will favors the drug absorption. That is important. How it will favor the drug absorption? Because bound form of a drug, it will act as a temporary storage of drug. So it will favor the drug absorption. Only free form of a drug is available for action, metabolism and excretion. We know that, right? Then when free form or free drug levels in the plasma fall, bound drug is released. When bound drug or bound form of drug is released, when free form of a drug levels falls, plasma concentration of a drug falls, then bound form of a drug is released, so that it will favors drug absorption. So that it will favors drug absorption, or we can say, what we can say, protein binding serve as a temporary reservoir of a drug or a temporary storage of a drug. Means drug is released when the free drug levels falls. And one more thing, it will prolong the duration of action of the drug. It will prolong the duration of action of a drug by delaying its metabolism. Okay? How come it will prolong the duration of action of drug? By delaying the metabolism of a drug. Because bound form of a drug is not available for metabolism or excretion. So it will prolong the duration of action also. This is the clinical significance that we are discussing. Many drugs may compete for the same binding sites that may lead to displacement interaction. Many drugs compete for the same binding site. If this is drug A and if this is the drug B, and if A and drug B, if they are competing for the same binding site, if they are competing for the same binding site, so the drug which is having higher affinity will displace the drug which is having lower affinity. If the drug A is having higher affinity, so drug A will displace drug B because drug A is having higher affinity, right? Now, for example, here example is taken warfarin. Warfarin is a 99% plasma protein bound. That means only 1% is free. 99% is plasma protein bound form, and 1% is free form. If other drug like indomethacin, which is the NSAID, non-steroidal anti-inflammatory drug, when it is given along with warfarin, it will reduce the binding to the 95%. How come it will reduce the binding of warfarin from 99 to 95%? Because indomethacin is having higher affinity. It will displace warfarin from its plasma protein binding site. Now the free form of drug becomes 5% more. Initially it is 99%. When plasma protein binding of warfarin is 99%, right? When indomethacin is given, it will displace the warfarin from its plasma protein binding site. If it will displace, what does that mean? The free form of a drug is increase. Initially it is only 1%, now it is 5%. Now it is 5%. That means there is a five-fold increase in the free warfarin levels. Plasma concentration of the warfarin increases. That may result into warfarin toxicity in the form of bleeding. Why there is the chances of bleeding increases? Because there is a increase in the plasma concentration of warfarin. Why there is increase in the plasma concentration of warfarin? Because indomethacin is having higher affinity and it will displace warfarin from the plasma protein binding site, because they are competing for the same binding sites. Then that is called as the displacement interaction. And fortunately, the body largely compensates all these things by enhancing metabolism and excretion. If the plasma concentration of drug increases, so metabolism is also increases and the drug will get excreted. So fortunately, body tries to compensate all these things by enhancing metabolism and excretion. Now we'll see what is the effect on volume of distribution. If drug is highly bound to the plasma protein, now which are the drugs which are having high plasma protein binding? The drugs like warfarin, benzodiazepines, furosemide, calcium channel blockers, digitoxin, they are all having high plasma protein binding. So they will behave like a large molecule. It will behave like a large molecule, and if they are a large molecule, they are more likely to stay in the plasma. And if they are more likely to stay in the plasma, what will happen? They will less distributed to the tissues. They will not go to the tissues. That means they will stay in plasma. If they are not going to distribute it in the tissues, that means there is a reduced volume of distribution or less volume of distribution. So what we can conclude from this, the drugs which are having high plasma protein binding, they have less volume of distribution. Why? Because they are act as, or they behave like a large molecule. If they behave like a large molecule, because they have high plasma protein binding, they more likely to stay in plasma. If they are more likely to stay in plasma, that means they will less distributed to the tissues. And if they are less distributed, that means they have reduced volume of distribution or less volume of distribution. Now, the chronic renal failure, or in patients with chronic liver disease or chronic kidney disease, they may lead to the hypoalbuminemia. Hypoalbuminemia means serum albumin levels decreases. If the serum albumin level decreases, so they reduce plasma protein binding of drug. The acidic drugs means they will bind to the albumin. Acidic drugs bind to the albumin. But in cases like chronic renal failure or chronic liver disease, there is a hypoalbuminemia. There is a less albumin levels. Less albumin, so drug will bind to the albumin in less concentration. So that may increases the free form of a drug. That will increase the plasma concentration of a drug. That will increase the toxicity of drug, because free form of a drug will increase. So highly plasma protein bound drugs should be carefully used in patients of chronic renal failure or chronic liver disease. Some displacement interactions that we have to discuss here. When salicylates or aspirin is given along with sulfonylureas or antidiabetic drugs, when salicylates like aspirin, when it is given along with sulfonylureas, which is a oral antidiabetic drugs, it will displace the sulfonylureas. Salicylate, which is having higher affinity, it will displace sulfonylureas. So what will happen? Free form of sulfonylureas increases, plasma concentration of sulfonylurea increases, and unnecessarily there is a chance of severe hypoglycemia. There is a chance of severe hypoglycemia. Indomethacin and phenytoin, if they displace warfarin from its plasma protein binding site, what will happen? Same thing will happen and it may lead to warfarin toxicity. Sulfonamide and vitamin K, it will displace bilirubin, and that's why there is a chances of kernicterus in neonat. There is a chances of kernicterus in neonat because sulfonamide will displace bilirubin or vitamin K will displace bilirubin from its plasma protein binding site. So bilirubin level will increase and that may lead to the kernicterus in the neonates. Same thing happens with the salicylates. Salicylates displace methotrexate, which is the anti-cancer drug, or methotrexate that is used in the rheumatoid arthritis. So it may increase the methotrexate toxicity. It may increase the methotrexate toxicity. So all these are the displacement interactions which are related with the plasma protein binding. Now, one thing you should know, two highly plasma bound protein bound drugs do not necessarily displace each other. Means it is not a thumb rule that one drug will displace another drug. For example, probenecid and indomethacin. This probenecid and indomethacin, these are highly plasma protein bound drugs, but they do not displace each other. Why do they not displace each other? Because binding sites may not overlap, means they are not competing for the same binding sites, so they will not displace each other. Similarly, one more thing, acidic drugs, they do not generally displace the basic drugs and vice versa, right? Now, dialysis in drug poisoning, this is important. In case of plasma protein binding, certain drugs can be removed by dialysis. Now, which are those certain drugs? Dialysis does not filter proteins. This is important thing. Certain drugs can be removed by dialysis, but dialysis does not filter proteins. So therefore, drugs which are having high plasma proteins like diazepam cannot be removed by dialysis. Are you getting my point? Dialysis does not filter proteins. Dialysis does not filter proteins. So drugs having high plasma proteins like diazepam cannot be removed by dialysis, right? So dialysis removes only those drugs which are present in sufficient free concentration in plasma. Dialysis removes only those drugs which are having free concentration in plasma. So drugs with high volume of distribution, more in tissues and less in plasma. What does that mean? High volume of distribution means more they will get distributed into tissues and they are less likely to stay in plasma, are very difficult to remove by dialysis. They are very difficult to remove by dialysis, and the drugs which are very difficult to remove by dialysis are digoxin, imipramine, propranolol, verapamil. These are the drugs which are having high plasma protein binding, so they are less likely to. So drugs having high volume of distribution, means they will distributed to the tissues and they are less likely to stay in plasma, are difficult to remove by dialysis because digoxin, imipramine, propranolol, verapamil, they are less likely to stay in plasma, so they are difficult to remove by dialysis. Drugs having low volume of distribution and low plasma protein binding are good candidates for dialysis. For example, salicylates. Now we should know what are the drugs which are having high plasma protein binding. The drugs which are having high plasma protein binding like benzodiazepines. Which benzodiazepines? Like diazepam, chlorodiazepoxide, midazolam, or these are the benzodiazepines which are having high plasma protein binding. chloropropamide, tolbutamide. These are the sulfonylureas, cyclosporin, fluoxetine, imipramine, warfarin. All these are the drugs which are having high plasma protein binding. Now, in short, clinical importance of plasma protein binding. It will definitely going to alter the duration of action. How it will going to alter the duration of action? Drugs with high plasma protein binding, usually they are longer acting. Duration of action, because it will inhibit or it will delay the metabolism. That's how it will prolong the duration of action. Second thing, distribution. Distribution means high plasma protein binding likely to stay in plasma. Thus, the drugs which are having high plasma protein binding, they have low volume of distribution. Then third one, displacement. High plasma protein bind drugs can be displaced by another highly bound drug. Means one drug which is having higher affinity, it will displace the drug which is having lower affinity if they are competing for the same binding site. If they are competing for the same binding site, that will result into the displacement interaction. And in case of dialysis, it is not effective for the drugs which are having high plasma protein binding, because most of the drug is in a bound form, so they are less likely in a free concentration in the plasma. So dialysis is not effective for the drugs which are having high plasma protein binding. So this is all about the clinical significance of plasma protein binding of drugs. That's all. Thank you.